This is part 16 of emergencies in first aid, and we talk about bleeding. Bleeding is basically loss of blood from circulation or from blood vessels like arteries, capillaries, or veins. It's also known as hemorrhage. So arteries carry blood which is moving at high pressure because it's coming from the heart. So meaning that if it has been, let's say, torn or something like that, blood is going to be able to move very fast like that. Okay, and the blood is going to be, in case of bleeding from the arteries, the blood is going to be bright red in color. Capillaries have got low pressure and blood is going to ooze, and it is dark brown since it is a mixture of oxygenated blood and deoxygenated blood. And then for veins have got very much low pressure and blood flows out continuously. So the blood is going to be dark red or purplish in color. So by looking at the color, you know what blood vessel has been injured. What will be the effects of bleeding or hemorrhage? So depending on the amount of blood lost, the rate of loss, whether there is a rapid loss as in arteries and veins, okay, as in arteries and veins, it can result in shock. Remember, shock is basically someone doesn't know what is happening because of inadequate supply of blood to the brain. So the rate of loss of blood will affect really what is happening, and also existing hemoglobin levels. If you are having a lot of hemoglobin levels, at least enough of oxygen is going to be carried. But if the injury has led to a lot of hemoglobin being lost, it means that oxygen is going to be lead to transported, and that will lead to different effects. Okay. So there are different types of hemorrhage or bleeding. There's an external hemorrhage. This one is the one which is visible on the body surface. Internal hemorrhage can be revealed, for example, mouth or nosebleed from orifice or concealed in a body cavity. So those are internal hemorrhages. It's showing that somewhere inside the body there is actually blood that is coming out. Okay. And then you have got, what are the signs of internal hemorrhage or internal bleeding? You feel some pain, tenderness, swelling, deformity, a cold, clammy skin, rapid and weak pulse, uncontrolled restlessness, excessive thirst, vomiting of blood, blood in urine or in feces. You know that there is bleeding inside. Hemorrhage can occur as primary, secondary, or reactionary depending on the time of infection. Primary hemorrhage is going to occur at the time of injury. Reactionary hemorrhage is going to occur within few hours after injury or operation, and that is usually between 12 and 24 hours. Secondary hemorrhage occurs within 10 days of injury or operation due to sepsis. Okay, in that period. Sepsis is basically there's something like an infection. How do you get to manage bleeding? The first thing that you want to do is, there's supposed to be natural arrest of bleeding. Natural arrest here, there is arterial constriction. Naturally, the body wants to manage when the body itself, without you doing anything, the body manages bleeding. So the arterioles are going to be able to constrict to become small by contraction of smooth muscles, and then there's going to be clotting mechanisms to prevent bleeding. The principle is to assist natural arrest. So the body naturally wants to prevent bleeding. So what you want to do is, if you see someone who is bleeding, you want to assist the natural mechanisms of the body in order to prevent bleeding. Okay. You are going to lay the casualty flat for moderate to make sure that you moderate severe bleeding. That is why you are laying the casualty flat. So there's going to be some direct digital pressure on pressure points. A point where a blood vessel passes near a bone can easily be compressed to cut off blood supply to the injured area. Say, for example, you know that, let's say, your leg is bleeding, and you know that blood, okay, at this location, there is going to be a blood vessel. So, what you can do is that you can perform a direct digital pressure on it, on that point where you know that a blood vessel is passing, so that you can prevent blood from going down all the way to where there is bleeding happening. You can also perform a direct pressure with a pad and bandage. So here there is just a plugging the wound, then applying firm dressing and pressure. Okay. You can also use a tourniquet. A tourniquet is used as a last resort. Now, a tourniquet you are going to apply for 15 to 20 minutes and then loosen for 5 minutes to allow circulation. So a tourniquet is, think of it, you place a compression. Okay, more like a compression. Think of, you get a cloth and then you tighten it around the arm so that blood stops flowing to where there's a wound. But this one is not is too good because there can be the death of tissue on the portion where there is no blood supply. Okay, so what you are going to do is, if you use a tourniquet, 15 to 20 minutes you are going to loosen it to, so that you allow circulation to reach those far ends. You are going to use protective barriers to control bleeding, for example gloves or thick layers of dressing, because if someone is having some kind of disease or sickness that can be spread via blood and then you are just open like that, you can be infected. Avoid direct contact with blood. Wash hands after providing first aid. So this is how we can manage bleeding, all right? You can apply direct pressure on a point where you know there's a blood vessel running. You are not preventing the entire region. You are not compressing the entire region. Just a point where you know that there's a blood vessel. Okay. So there are also some nosebleeds that can be seen, which is also known as the epistaxis. So nosebleeds, you are going to make sure that you sit the patient upright. Okay, no stooping, meaning that bend one's head or body forwards and downwards. So the person should not bend forwards and downwards. That is no stooping. And then apply cold compress to the roof of the nose and nape of the neck. You want to apply something that is at least cold to the nose. You are going to pinch tip of the nose for 15 to 20 minutes. Do not allow the patient to swallow the blood or the blood, okay, that is coming out of the nose. Don't allow the patient to do that. So this is a nosebleed, as we can see here. So you don't want the patient to bend forward and downwards, you want them to be upright. Okay, so this is what you can see. All right. So that is it on this part. Thank you so much for watching. In the next part, we'll talk about fractures and how you can be able to manage